2026 is the year of crushing Medicare changes, and if you or someone you love is on Medicare, I need you to stop what you're doing right now, because what I'm about to share is directly impacting millions and millions of seniors in a pretty nasty way. Certain Medicare plans have just been dropped from over 400 counties across the entire country by the largest insurance providers. That's not a typo. Over 400 counties. And honestly, we kind of foresaw this coming. I'm Tony, and here at Retirees Benefits, I've been tracking these Medicare changes for months. In fact, late last year in 2025, I came out multiple times saying, get ready if you are on Medicare. We were seeing shifts within these Medicare plan changes that we'd never seen before. Plans being discontinued and eliminated in a huge way going into 2026. Well, now that we're here in 2026, it's happening, and it's worse than we thought. I've spent years helping people navigate healthcare, benefits, and financial assistance. I've sat with my own family members through insurance changes, and I've made it my mission to break down these complicated systems into plain English that actually helps real people. So today, we're going to talk about what's happening, who's affected, what your options are, and what you need to do right now. Let me pop this article up on the screen right now so you can see and read for yourself exactly what we're dealing with. This is nasty, but you need to know. We're talking about two major healthcare insurance providers here, and these are the two largest ones out there. This isn't even including some of the other smaller insurance providers that are also dropping plans left and right. United Healthcare has dropped 225 counties across the country and only added 14 counties. Let that sink in. They dropped 225, added 14. That's bad. Humana has also dropped 198 counties and only added 5 counties. Collectively, over 400 counties, just from United Healthcare and Humana alone, have been dropped across the entire country. And again, that's not even including all the other smaller insurance providers that are dropping plans too. This is impacting multiple millions of seniors all across the country, and I recognize that some of you in this community are being directly affected by this. I've seen the comments down below, and it breaks my heart. If you're a senior on Medicare in one of these 400+ counties, you're affected. If you're a caregiver for an aging parent who suddenly lost their plan, you're scrambling to figure this out. If you're someone with disabilities who qualified for Medicare early, this impacts you too. Veterans on Medicare, you need to pay attention. And to the moms and dads caring for elderly parents while managing your own family, I know you're already stretched impossibly thin. And now this. Now, let me explain something super fast because this is crucial. There's this thing called the crosswalk policy, and if you don't know what that is, this might explain why you're suddenly having problems. Because so many insurance providers were dropping plans, they put this crosswalk policy in place. Basically, if you're on a plan that they're discontinuing, they automatically place you into a like-kind plan. In other words, a plan that most accurately resembles the plan you had before. They basically just say, here's a plan that's pretty similar to what you had. This should probably be a good fit. And they automatically put you on that new plan. Sounds okay in theory, right? But here's the problem. I've been seeing this comment way too many times so far this year, and I fear it's going to impact a lot more people as we move further into 2026. The comments I'm receiving are devastating. Can't see my doctor anymore. I went to the pharmacy. Why are my prescriptions 300 times more than they were? I used to pay $5 a month for my prescription. It's $60 a month now. What happened? I can't go to the doctor I was seeing. I can't even go to the office or the clinic. I don't have access to my hospital system. These are real people, real situations. People who had appointments scheduled showed up and found out they weren't covered. People who had to cancel appointments or suddenly need to find new doctors. It's because of all this, the counties being dropped, the plans discontinued, people being automatically put onto other plans through this crosswalk policy without fully understanding what changed. Unfortunately, there are a lot of people experiencing this right now, thinking, oh wait, I guess my plan did change and I didn't realize it. Now, I mentioned this a lot last year, and I need to say it again because it's so important. It's so easy to get distracted by the premium. So many people just look at the premium and say, look, my plan didn't change. The premium is the same. But that's a distraction because a lot of times within the plans, things change in a huge way kind of behind the scenes. What doctors are still covered in or out of network? What procedures are covered? What about deductibles and co-pays and co-insurance, max out-of-pockets, different clinics or hospital systems that are included or maybe not in network anymore? That's a major situation, and that's why people are getting blindsided. Let me be real with you. If your plan got dropped and you got automatically moved to a new one through this crosswalk policy, things have changed. Even if your premium looks the same, even if the plan name sounds similar, your network might be different. Your doctors might not be covered. Your prescriptions might cost more. Your hospital might be out of network now. This isn't a small thing. This is your healthcare. This is your ability to see the doctors you trust, get the medications you need, and afford the care that keeps you healthy. Think about this for a second. We're talking about 400 plus counties just from 2 insurance providers. How many counties would it be if we considered all the insurance providers, even the smaller ones? I can't even imagine. It would be a huge, huge, huge number. And how many millions of people are being impacted by that? A lot. Unfortunately, way too many. All states are being impacted by this in a huge way. This isn't regional. This is nationwide. Now, I'm not going to pretend to have all the answers about why insurance companies are making these decisions. But what I do know is this. You are one of 70 million people on Medicare, and you deserve coverage that actually works for you. The healthcare system is complicated and broken in a lot of ways, but that's not your problem to solve. Your job is to protect yourself and your family. If you've been impacted by your county not being covered anymore, drop a comment down below. I would love to hear from you on this. This is impacting tons of people across the entire country. Multiple millions of people on Medicare are being directly affected, and you're not alone in this. Share your story. Ask your questions. This community is here to help each other through these challenges. Look, I know this feels overwhelming. I know it's scary when your healthcare coverage changes without warning. I know it's frustrating to find out your doctor isn't covered or your prescriptions cost way more. Medicare changes are coming fast in 2026, and you need someone in your corner who's paying attention and breaking down what it all means for real people. Free Medicare help. It doesn't get any more clear than that. Connect with a trusted advisor, along with the thousands of other people from this community who've already made the call. You deserve to have someone who knows the system, who can navigate all these changes, and who can find you the coverage that actually meets your needs. Please enjoy your day. I hope this helps. Hit that big subscribe button down below if this video was helpful. Share it with anyone you know on Medicare because this information could literally save them hundreds or thousands of dollars. Your mom, your grandmother, your neighbor, your friend from church, anyone on Medicare needs to know about this. Use the big share button down below to get this information out there, and please, drop those comments. Let me know your thoughts. If you've been impacted, until next time, take care of yourself, protect your healthcare coverage, and I look forward to reading those comments down below. Thanks for being part of this community, and I'll see you in the next video.